So my practicum was Aging in Place in Tumbler Ridge, BC. So I'd like to begin with the respectful acknowledgement to the Denisah, the Saulteaux, the Témiscamingue, the Cree, and the Métis people of the Northeast BC region, including Tumbler Ridge, BC. This includes the McLeod Lake Indian Band, the Saulteaux First Nations, the West Moberly First Nations, the Kelly Lake Cree First Nations, and the Kelly Lake Métis Society. My name is Erin Powers. I'm completing the BA Health and Community Services program and was fortunate enough to take all 4 focus areas during my program. I live, work, and attend university by distance from the Peace River region of BC. I gained my practicum experience at the Community Development Institute, commonly known as the CDPI, which is part of the University of Northern British Columbia. The CDI maintains an office in Fort St. John, which is where I took part in my practicum work. The CDI works throughout northern BC in collaboration with various communities to encourage the development of strong community and economy. They do this through research, education, collaboration, dialogue and policy discussions, innovation, and community transformation and renewal. The project that I had the opportunity to work on was focused on aging in place. Tumbler Ridge is a small community nestled in the northern Rocky Mountains with a population of about 2,200. This industry town was built in the early 80s to house the mine workers and their young families. Most houses in the community are similar detached split-level houses of that era. The community has limited healthcare services with 1 medical doctor and a healthcare center, but no hospital. The community of Tumbler Ridge recognized the need to identify the feasibility of older residents to age in place, what in-community housing stock was available to them, and the adaptations that could be made to current housing stock to keep people safely in their homes longer, as well as to the supports and services that might be needed now and into the future. Just a quick photo note, these are my in-laws. They've lived in their same house for 48 years and are reaching that age when adaptations are needed to be made if they want to continue to live in their house, which of course they do. My role with the CDI began with the introduction of the Tumbler Ridge project through a literature review to discover existing works and tools that might be used for the project. I then developed an interview tool that will be used as an in-home assessment for accessibility of housing and aging residents. It will also be used to determine supports and services that might assist them to age in place. I tested the tool on family members in my community and had the CDI team test on their family members as well. I then took the results and revised the tool accordingly. I next began gathering resources to leave with community members during the in-home assessments. I also decided to create a short Your Age-Friendly Home brochure, which gave some tips on home adaptations to safely age in place. Finally, the project began the next phase in which community stakeholder engagement began. Here I assisted with identification and communication with community members. This portion of the project, along with the in-home community portion, was cut short because of the COVID-19 pandemic. I have, however, been asked to return under employment to continue the project when the time is right. It was important to me that the public health and social policy guiding values were present in my practicum work. The 3 that I found most relevant and was able to draw upon were critical analysis drawing on principles of social justice and equity, community-based approaches to research and knowledge development, partnerships with people and population served, which was also very important to the CDI, and, of course, cultural safety. The community of Tumbler Ridge has an Indigenous population of about 17%. It was extremely important that the project adhere to cultural values through respect, trust, mutual sharing. I want to further my personal and professional commitment to the Truth and Reconciliation Commission with the identification and commitment to this specific call to action. In order to address the jurisdictional disputes concerning Aboriginal people who do not reside on reserves, we call upon the federal government to recognize, respect, and address the distinct health needs of the Métis, Inuit, and off-reserve Aboriginal peoples. In conclusion, I would like to point out some of the insights I had during the program and my journey. The goal to improve human health and well-being is one of the most complex objectives in human history, but the possibilities are numerous when we are able to understand the determinants of what produces or reduces human health. It could be as simple as installing a grab bar in an older adult's bathroom, or is an immense as a global health initiative to stay home and stop the spread of a contagious disease. I wanted to say thank you to my team, Natalie and Betty, and the Public Health and Social Policy team, my supervisor, Marlene Morris, and the CDI team at UNBC, my fellow students, with a special shout out to Lisa, who has been a major source of peer support during my program, and of course, my amazing family. A quick note on the photos on this page. They are from the Tumbler Ridge area, which I plan to spend most of my summer hiking and enjoying some of my off-school time. Congratulations to everybody on their BA degrees.